Hello friends, this is Sumit Bagul and I welcome you all to the brand new episode of Sex, only unique formula for happy life. Friends, whenever we face any medical or health related problem, what we usually do? We share that problem with our family or with our friends, but whenever we come across any problem which is related to our sexual life, we don't share it with anyone. Rather, we try to hide it, right? And for this reason, we have started this special sex education show called Sex, only unique formula for happy life with Dr. Vijay Dahifale. Friends, this is one of its kind platform where you will be able to share all your sex related questions, and Dr. Vijay Dahifale will guide us on how to solve your sex related problems. But before starting the actual talk, let us all know about Dr. Vijay Dahifale in detail. Dr. Vijay Dahifale is very famous sexologist, urologist and andrologist. He has his clinics in Aurangabad, Hyderabad, Delhi, Dwarka Sector 23, Pune, Nerul in Navi Mumbai, Dadar, Andheri, Kalyan, Nashik, Ahmedabad and Dubai. Dr. Vijay Dahifale frequently travels in India and abroad for seminars and conferences related to sexology. So friends, now that you all know about Dr. Vijay Dahifale's various clinics, we have doctor here with us. Doctor, welcome to the show.
Thank you very much, Sumit.
Doctor, we are speaking about sexual dysfunction and with public demand, you have selected all these unique topics.
Yeah.
So, sir, in today's episode, we would like to know about sex and vaginal depth.
Definitely.
So, sir, what is the vaginal depth as per your knowledge?
Definitely, Sumitji. Under this banner of sex education, sex awareness and sexual safety, we are seeing all anatomy in males, anatomy in females, sex organs what are normal in males, sex organs what are normal in females, unless and until you know what is normal and how you can identify what is abnormal. So, what is exactly vagina? The external lips is the external vagina and the part which is inside in a depth, which is a mucosal covered area, you can see in the figures, that is a internal vagina. And what is the depth of internal vagina? 4 to 6 inches is the depth of internal vagina. How it changes, you can roughly say the width of your hand, that is the size of vagina, but it is not fixed one, it is changeable. How it changes? One by one we'll say it.
Definitely. Sir, while having sex, does the size of vagina changes or it doesn't change?
Yes, excellent. When you are activated, that's why foreplay is important. Unless and until your partner is activated, unless and until there is a lubrication, there occurs changes in the muscles. This vagina is a very soft tissue with a very good muscle, smooth muscles. So definitely it is elastic. And at the time of at the time of activation, by 2 to 3 inches, the vaginal depth increases, and that is the reason when you are penetrating at that time, that partner doesn't get any pain or they doesn't get any type of irritation, and this is the reason why this organ is made soft, elastic and flexible. That's why I can say during excitation, during orgasm also, the vaginal depth is changed.
Definitely. Sir, we have first caller with us. We have Shashank from Pune. Shashank, you can ask your question to the doctor.
Hello.
Hello.
So my partner gets pain. During sex, any treatment available?
Excellent.
Definitely.
I'll continue same talk. Why there is a pain during sex? One thing, there is no foreplay, there is no lubrication, some type of vaginismus. Means vagina contracts immediately by the fear. Sometimes partner feel that by penetration I will get a very big pain. Then again there are some vaginitis, vaginal infection like vaginosis, then some cervical infections, some uterine causes. Such a type of conditions, there occurs inflammation, and due to this inflammation there occurs irritation and your partner become reluctant. That is called as a sexual dysfunction in female. So they have to consult with sexologist, urologist and andrologist. This is a very good treatment available, and in such a type of pain, if your partner is not allowing, you are not supposed to do the sex. That's why I always say consent of partner is very, very, very important.
Definitely, sir. Moving ahead, one very important question is that when should a couple resume having sex after pregnancy?
Yes, definitely. Actually, after delivery, what happens? After delivery, there are so many changes in your body. The vagina is lax. Again, I'll tell you, after delivery, the prolactin levels are on higher level because they are breastfeeding. And naturally, how much time is required to go normal to a shape of this vagina, minimum 3 months. So after 3 months, definitely partner gap for sexual intercourse, or they can go for this any type of masturbation, or even vaginal intercourse also is allowed, but not before 3 months, as they are lacking their sensation. There is a loss of libido, and all changes, the laxity which are occurred in the vagina, it has to be contracted, and even that uterus also has to get involuted. Involuted means it has to become smaller. So on average, I will take 3 months is the proper time for resuming the sex after delivery.
So, but what happens
Yeah.
to vagina after delivery?
Yes. So what are the changes which are occurring? I am telling you, it is the smooth muscles. See, if you compare the seizure and delivery, see, organ is soft. It has a capability to become normal. It comes to the normal shape also. But the introitus means the area which is called as a hymen, due to delivery, due to that head pushing, there occurs the breakage in this hymenal region. So I will tell you, after 3 months, it becomes normal. Only irregularity is seen, but any type of vaginal tightening or anything else you want, there are very nice O shots, means platelet-rich plasma therapy. If you inject it to that, the introitus can become small, or by operating also you can make it a very normal. So in short, I will tell you, few changes in the orifice or introitus occurs. Otherwise, that vagina contracts and become normal day by day after 3 months.
Sure, sir. We have one more caller
Yeah,
with us. We
sure.
have Rita from Ahmedabad. Rita, you can ask your question to the doctor.
Hello, sir.
Hello.
Sir, for small vagina, any treatment available?
Okay, excellent.
Okay.
Now they are going in congenital anomalies. So what are congenital anomalies? Absence of vagina. This also happens to me. Then absence of your this all hymen, or sometimes hymen is intact. So for small vagina, what to do? In small vagina, it is a painful sex, and there is a difficulty in penetration. So in such a cases, there is a vaginal dilatation. They have to visit to sexologist, urologist and andrologist. We can give a dilatation if suppose it is expandable, because we have told you it is a very smooth and expandable tissue. But if it is again smaller than that and that partner is facing problem, you can go with a vaginal reconstruct surgery by using graft or by different type of operations. Vaginal reconstruction, you can definitely make it normal.
Sir, you just now spoke about
Yeah.
O-shot. You are speaking about
Definitely.
various
Surgeries. Yeah.
But what is the role of Kegel exercise?
Yes, excellent.
To bring vagina
To bring
to
it normal.
Yes.
So apart from these surgeries, apart from this O-shot injections, naturally she want to become normal. So what is Kegel exercise? I will tell in short. It is a contraction of pelvic floor, means pubococcygeal ligament. In that ligament, this vagina and urethra is located. How the action is to be done? When you are passing a urine, the action you make to stop the urine in between, that action is called as a exercise, Kegel exercise action, to make floor too and small. So in this case, how many times you have to do? 30 to 40 times you have to contract the pelvic floor, you have to relax it. In sitting position also you can do it. So by doing this, your duration of contracting this vagina to make that vagina small, to make it tighter, so that your partner will be very happy even after delivery to perform the sex, and they can get a good orgasm and good enjoyment. So Kegels is a natural method to make your pelvic floor tight and your vaginal orifice also very nice.
Sir, one last question. What changes occurs to clitoris while
Definitely during this sex
During
or
the
this
excitement.
this excitement,
Yes.
what happens? Definitely like a male. What happens in male? If the flow is started to your penis, you get erection. You can see long penis. You can see hardness or total rigid penis. The same thing happen in female also. Towards the clitoris, when it goes, it changes the color of this clitoris. It become pink colored, and it becomes tight also. You can say at least 1 to 1.5 centimeter, and it is a sign of good excitation. And at this moment, if there occurs this clitoral masturbation, they get a very nice sensation, very nice orgasm. And anything more information you want, you can ask me.
Sir, due to time constraint, we actually have to stop here in this particular
But
episode.
we'll come back again.
Definitely.
Yeah.
But friends, if you want to get in touch with Dr. Vijay Dahipale, then there are various contact details available on your screen, and through which you can take Dr. Vijay Dahipale's consultation, and I am sure Dr. Vijay Dahipale would be happy to help you all. Well friends, it's time to stop here. Thank you so much.